So hello all, good morning, good afternoon, good evening, wherever you are, and welcome to our pesticide discussion forum run by the University of Cape Town with financial support from Sweden through the Swedish Chemical Agency, CHEMI. You are all most welcome. It's nice to see many of you joining. Please do take a moment to introduce yourself in the chat room with your name, organization, and country. And thank you to those of you who've already introduced yourself. For those of you who are new to our discussion forum, this is not a webinar, but really a discussion, a community of practice amongst those of you who are interested in pesticide issues to give you an opportunity to discuss. And the online platform aids us in that opportunity. So everyone will be keeping their microphones and their videos off during the next hour and a half, except for our presenter today and myself, who will be facilitating. I'm Professor Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa. We do ask that you, though, please engage and be most interactive in the chat where you're introducing yourselves at the moment. We will have 3 questions today. So our presenter will give us an introduction and an introduction to each of the questions, and then invite you to discuss them in the chat room. There will also be poll questions on Mentimeter. So we ask if you have a second device, perhaps to have that ready so that you can answer the poll questions there. Or of course, you'll be able to answer it on the device you're on at the moment. So with no further ado, I am very excited that we are having this discussion today around the hierarchy of control. Some of you are familiar with the hierarchy of control that has been introduced from industrial hygiene, and maybe for others of you, this will be a new concept. And what is important is how to apply the hierarchy of control to pesticides risk management. And we're very fortunate today to have Debbie Muir with us, who is a successful graduate of University of Cape Town's postgraduate diploma in pesticide risk management, who has really been an ambassador and gone forth and applied many aspects of what she learned in the program. And so Debbie, we're very grateful for that. So Debbie is a specialist program manager for the Department of Forestry, Fisheries and Environment in the in South Africa. I was about to say in the University of Cape Town, where she's been and has 20 years of experience in pesticide management. She was part of the technical working group that compiled and published the Forestry Stewardship Council's recent pesticide policy in 2019, and is part of the technical working group on international generic indicators for the International Forestry Stewardship Council's pesticide policy as well. And she's also a member of the SADC, Southern African Pesticide Regulators Forum Committee, that's working on highly hazardous pesticides, as well as the ICGEB, which I'll let her give you the details of the acronym, Technical Working Group on Biopesticides Policy. So she has a lot of experience and is currently very active in applying her knowledge and what she's learned. Debbie, thanks again for being part of the discussion forum and for presenting for today. I hand over to you.
Thank you very much, Prof. Thank you everybody for joining today. I'll start the presentation now and welcome everybody. I'm going to give you a background on the hierarchy of controls in South Africa. So in South Africa, various pesticides are used in various operations, from agriculture to environmental operations to forestry. But in the Department of Forestry, Fisheries and the Environment, we mostly do invasive alien species control. So not just plants, but animals, nematodes, microbes, etc. But the bulk of our work is done with herbicides on invasive alien plant control. So we're looking at 375 invasive plant species that we control, and also 135 invasive alien non-plant species, which are the birds, the reptiles, the microbes, etc. And there's various methods that are used, but most of these methods incorporate using teams of workers. Now, the teams of workers that we use are EPWP workers from the local communities. And our aim, which is the priority aim of our pesticides policy, is to safeguard the workers' health, the people that we employ, as well as their protection of the environment by using the least harmful pesticide that we can use. And also by utilizing the hierarchy of control. So we implemented the hierarchy of control when we updated our pesticide policy, and also implemented the global harmonized system of classification of labeling of chemicals. Next slide, please. Okay, so if you look at that slide, in South Africa, we're basically implementing or trying to control 2.4 million hectares of invasive alien species. And those are easier to control, believe it or not, than non-plant invasives, because plants don't move, obviously. So the invasive plants are slightly easier to control than the non-plant invasives. Next slide, please. So if you're looking at that slide, that was our starting point when we looked at the pesticide policy, when we started looking at how to change or how to improve on the pesticide policy. We looked at the World Health Organization classes, which were then replaced by the GHS categories. And what was very interesting here is we were very happy in a way that the GHS categories are now being implemented on the pesticide labels in South Africa come October 2022 by our new HCA regulations, which is the hazardous chemical agents regulations. And the reason for that is with the pesticide labels that were color-coded from the 1A, which was extremely hazardous, which had a red label, to the U, which was the unlikely to present acute hazard, which was the blue and the green labels. There was a large percentage of the population in South Africa that had red-green color blindness. And with a large portion of illiterate people not able to read labels, they were basically looking at the color coding of the labels to tell the difference between whether the pesticide was a hazardous pesticide or not. So if you had red-green color blindness, that was a huge risk to us, because they were probably they were not making the distinction between extremely hazardous pesticides and not so hazardous pesticides with the color blindness. So we were a bit concerned about that. Next slide, please. So the other concern that we had when we were looking at our pesticide policy was the pesticides that were used in the same high-rec group, the herbicides that we used in the same high-rec group. And what I'm showing you here is that a lot of pesticides used in South Africa are all in the same high-rec group. So this is an indication of our old pesticide policy, where we extracted just a piece of the most used pesticides by the department. You will notice there's 2, 4, 6, 8 pesticides that were in the top 10 pesticides used by the department. They're all in the same high-rec group. So there was a huge risk of developing resistance to pesticides. So that was one issue that we also had to look at, was were we not creating resistance to invasive species in South Africa by using pesticides all in the same high-rec group. So that's another thing that you also need to have a look at when looking at the hierarchy of control and the GHS, and you're putting together your pesticide policy, is to also take into account whether you are developing resistance by using pesticides in the same hierarchy group. Next slide, please. So what we also have, the other criteria we had to consider are the pesticides with unmanageable risk. So when looking at the hierarchy of control with the elimination and substitution, the first pesticides that we looked at to eliminate were the endocrine disrupting, the pesticides with endocrine disrupting properties, the POPs, and the carcinogenic and immunotoxic potential pesticides, the class 1As, the highly hazardous pesticides, class 1Bs, and in South Africa, there's still 135 HHPs registered for use in South Africa. And then the pesticides with frequent and severe poisoning incidents, the arsenics and the 2As. There has been a lot of pesticide poisonings with arsenics. And an example of that is MSMA, for instance, in South Africa. So that was one that we immediately removed from our pesticide policy. And we looked to try and get a substitution for MSMA, which is the top pesticide for use on cacti in pretty much in the world. So that was a bit of a problem because everybody loved MSMA. Next slide, please. So the NEMA is the National Environmental Management Act, which is the DFFE, our department's act to look at how do we encourage implementation of comprehensive pesticide reduction strategies. And that's what we started looking at when we redeveloped our pesticide policy. And to look at substitution principles, that's where we started looking at the precautionary principles and the hierarchy of control to promote pesticides with lesser toxic ones and non-chemical alternatives. Because what you also need to take into account is that you don't always need to substitute with less toxic pesticides, but implement integrated pest management and look at biopesticides as an alternative to a chemical pesticide, because there are biopesticides on the market, especially for invasive alien plant species. And you'll notice when I speak a little bit later, there are 13 biopesticides currently on the market for invasive species. Review existing registrations. This is not something that's done often in South Africa, so we are pushing for reviewing existing registrations of pesticides, especially the 135 highly hazardous ones that are still registered in South Africa. The waste management, including empty containers and obsolete chemicals, with regards to the Basel Convention. This is a big concern to us. Because there are plenty of empty pesticide containers out there, and the National Designated Authority for the Basel Convention is the Department of Agriculture, Land Reform and Rural Development, and they have outsourced that delegation or that responsibility to CropLife SA, who has put together container management programs for South Africa. But the concern there is that there is monetary, you have to pay for pesticide management programs in South Africa, which is a little bit of a concern, especially if you're looking at rural communities and previously disadvantaged communities. Next slide, please. So the NRM pesticide policy, we started updating this policy in 2012. We continuously review it. It covers all the herbicides and pesticides. It does not cover certain pesticides or herbicides. An example is MSMA, as I've said. The priority or the preferred pesticide is biopesticides, and I've given you an example of Cylindropasidium livei, which is a wood rotting fungus that is registered as its commercial name is Stumpout, which is registered for the acacia species. And also we have agreed controlled measures in line with international best practice. Next slide, please. So our herbicide species spreadsheet, which I sent as an example for you to look at, is our one-stop invasive alien species control program, which is linked to our pesticide policy. Our policy gets reviewed every 5 years, but the spreadsheet gets updated every 6 months with regards to any international best practice that is updated. It is linked to our Conservation Agricultural Resources Act species, as well as our National Environmental Management Biodiversity Act species. There's 424 species on the list, 14 treatment methods, 31 formulations, 53 herbicides, 13 biopesticides. But the concern here that you need to look at is there's only 3 herbicide categories. And this should be a concern, and this should be ringing alarm bells in your head, because this is where we might be pushing or might be causing herbicide resistance within the program, which is what we're currently looking at to try and increase our herbicide categories that we're looking at, but also to try and look at new novel mode of action herbicides. And there's 2 or 3 that we are waiting for registration, that we can then increase our species registrations for the novel herbicides. Next slide, please. Okay, that is an extraction. It's a little bit small, but I needed to get some information on that. That is an extraction of the spreadsheet. It gives you the species, all the pesticides registered for it. But further on in that spreadsheet, it gives you the recommended herbicide for that species, because what we've done is we've looked at the hierarchy of control. We've looked at the GHS, so all the hazard criterion for each of the herbicides. And we've done the environmental and social risk assessment with regards to all of the herbicides, and we've given you the safest one that you can use. So in this spreadsheet, so you can choose whichever one you want to use, but we have recommended the safest one for you to use. Next slide, please. So with regards to our safety, we have a health and safety officer that gives toolbox talks, which gives all the information with regards to the safety of the products. UCT's health department has helped us with herbicide toxicity research in the past, which we have used to update and implement with our health and safety policy, as well as our PPE policy and our pesticide policy. Our PPE policy was updated in line with the FAO PPE policy that was, I think it was published in 2020, if I'm not mistaken. And we have a self-assessment and compliance auditing directorate, which keeps us in line to ensure that we stick to all our requirements within our policy. What we have done is we've implemented a biomonitoring requirement within our health and safety policy, as well as our herbicide policy for all the pesticides that do have GHS requirements with regards to hazard criterions 3, 4, 5, and 6. That need biomonitoring with regards to frequency and duration of pesticides. We cannot at this stage eliminate or substitute. And then we also ensure that our health and safety policy is in line with the hazardous criterion agents regulations that were promulgated in March last year. Next slide, please. So our example of how we implemented the hierarchy of control in the GHS, we embarked on an elimination process in 2010. We eliminated 5 pesticides and we substituted 6 with safer ones. So MSMA, remember I told you the arsenic, which is the one that was with severe and frequent poisonings. We eliminated out of our pesticide policy, and we substituted with a safer one called Impala, which we went to the pesticide companies and we said, we need a safer alternative, please do your R&D, your research and development, and get us a safer one, which they did, called Impala. Garlon and diesel was used quite frequently in the Northern Cape, and Garlon is a volatile pesticide. It volatilizes at temperatures above 25 degrees Celsius. Northern Cape is a very hot climate, So if you do foliar applications with Garlon, which pretty much what's Garlon and diesel is a cut stump, and it can volatilize, especially if you put it in a carrier like diesel. That was quite a human health risk, but the carrier diesel is an environmental risk. It's very toxic to environments, especially sensitive environments like you find in the Northern Cape. So we went back to the chemical companies and we said, find a safer alternative for Garlon and diesel, which they did, Turbidor. The same with Sendero and the glyphosate with polyethoxylated toluamine as a adjuvant, which was used in foliar applications of prosopis species in the Northern Cape and bush encroachers. And we said we cannot do this anymore. We took that out of our policy and we substituted it with a safer alternative called Sendero. With our herbicide assistant programs with small scale farmers and communities, we're looking for especially also in drier climates like the Northern Cape where there isn't water easily available. We asked for a herbicide that we can paint on the stump to reduce the exposure to the applicator, as well as the environmental risk with overspray and spillage into the environment. And the pesticide companies came back with Kaput gel, which is basically a ready to apply gel that you paint onto the stump with a paintbrush. And then obviously for aquatic environments, we were looking for a glyphosate that did not contain polyethoxylated toluamine, which reduces the risk to human health and the aquatic environment. And they came back with two herbicides, Seismic and Kilomax. So it is possible to substitute for safer alternatives. You just have to look for them, or you have to make an active request to pesticide companies to assist. And then we're currently working on engineering controls where we can change formulations to ensure that the product is safer to the human health and the environment with the applications. Next slide, please. Okay, so what you need to do is you need to take steps to mitigate risk and lessen the impacts needed to implement the new PPE policy, and biomonitoring to monitor the human health risks in line with the Global Harmonized System of Classification of Chemicals and the Hazardous Chemical Agent Regulation. So ensure that you make sure that you are safeguarding the health of the applicator as well as the communities around the areas where you are going to be spraying. And note that PPE is the last step to protect people from risk. Thus, biomonitoring is required for acute and chronic risk where pesticides are used for certain pesticides that you still need to use, which fall into hazard criterions 3, 4, 5, and 6. Next slide, please. Okay, so there's your hierarchy of controls. So as you can see, elimination first, substitution, engineering controls, administrative controls, and PPE is your last one. So please do remember that PPE is not protective to the worker. Next slide, please. Okay, so that is the policy that you should all be using as a baseline when you are putting together your PPE policies, especially in let's call them tropical climates or African climates, because this guideline was written specifically for African climates. Next slide, please. Okay, so this is what you need to remember. Look at the species spreadsheet and choose the species you want to control. Then look at the herbicides that are registered for that species and recommend the safest herbicide by ensuring you look at the hazard criterion for each pesticide, the human health and the environmental risks, and ensure that you can mitigate with engineering controls, behavioral controls, or PPE, and do a risk assessment. I don't think many people do the risk assessment when choosing the safest pesticide, looking at how to mitigate for human health and environmental risk. Next slide, please. Okay, so an example of how to do an ESRA using hierarchy of control and GHS. You're going to do a cut slump application on a black wattle. Next slide, please. This is a desktop environmental risk assessment. You can also do it using a software program using like Primate, for instance, but this is just a quick look. So if you're looking at, these are the 1, 2, 3, 4, these are 5 registered pesticides for black wattle for a cut stump application. And here you can quickly see which each pesticide, what kind of risk it will pose to human health and the environment. And you can quickly see if there are women in your team, you shouldn't use Confront. If your black wattles are near the river, you can't use Plenum or Access. If you want to plant crops afterwards, you cannot use Hatchet or Plenum or Access. Actually, you can't use any of them because they're all persistent in the soil, which means that it's probably going to have an impact on your crops afterwards. But if you look right at the bottom, I'm saying to you, why don't you use IPM rather? Because there is registered biopesticide for black wattle and there are biocontrol agents for black wattle. So why not rather use IPM, an integrated pest management program for black wattle, instead of just spraying it with the pesticide? Next slide, please. So in closing, it is important to choose a PPE per pesticide category to ensure you mitigate for the exposure risk. In other words, if the exposure, if you're using a pesticide that has an inhalation risk, it's not important to put them in a Tyvek suit. It's important to ensure that their face is covered properly with a proper respirator, not cover their arms in a Tyvek suit. So you need to check that your PPE per pesticide category is important and is covered with regards to exposure risk. And ensure you have done the hierarchy of control properly to check that the GHS criteria and to ensure that you have mitigated the exposure correctly. Next slide, please. Question 1. Okay, so now question 1 is asking you, in your country or the country that you are in or that you work in, why do you think the hierarchy of control is the first tool you should choose to choose the correct pesticide in local conditions to safeguard human health and the environment? So it's asking you, in your country, why do you think the hierarchy of control is the first tool that you would use to choose the pesticide in your country, or not even in your country, but in the local conditions, so where you're going to actually apply that pesticide to safeguard the human health and the environment? Okay, you can start discussing.
Thank you, Debbie, and thanks for thoroughly taking us through that case study of how you've used and applied the hierarchy of control. You've given a lot of food for thought. So while people are answering the first question that you have posed, I also will encourage you, if you have specific questions that were raised by Debbie's presentation, you can also put those in the chat. And of course, Debbie, you can remain on and speak to comments that come into the chat rather than having to type.
Okay, I have one question here from, oh, hang on. The question was something about pesticide poisonings. I've lost it now. Yeah, Frederick. No. Someone asked, here we go. Yes. Frederick asked, you mentioned that as part of what was considered in the hierarchy of controls was pesticide poisonings. How do you go about setting the threshold for poisonings? It depends on what you mean by pesticide poisonings. If you're talking about the applicator, reaching his threshold or his body exposure indices of the pesticide that he's applying. It would depend on what pesticide is applied and whether he has reached it. So you would then have to do biomonitoring. So you wouldn't go about setting the threshold. The threshold has already been set. So depending on what the pesticide is, there is a body exposure indices already set for that pesticide. So you would have to monitor, depending on whether it's an acute risk. If it's an acute risk pesticide, you would have to take a urine sample and measure his urine sample and against the BEI, the body exposure indices, and see how close he is to that, to see whether he's reached his threshold, his body burden threshold. If it's a chronic exposure, so in other words, so if it's has the criterions 3, 4, 5, and 6, those are the chronic exposures. You would have to take a blood sample, and you would have to then test against those thresholds. So you would have to then first set up your biomonitoring program, and you would have to have all your exposure indices and your body burden thresholds set up. And you would have to implement a biomonitoring program first. And then you would have to first work out what your frequency and duration of your spraying is for each of those pesticides. And then if they exceed those, you would then have to implement a biomonitoring program. Frederick, does that answer your question?
Yes, Debbie, partly. What I meant, or what I was looking at was, let's say you talked of the frequency and severity. And so that's where my question really is. How do you decide, or how did you people decide that now this is the number, this is like frequent, this is severe? I know for severity, you can be talking about things like suicide and all that. But now in terms of frequency, how do you set that? That's really where my question was. Thanks.
Okay, no, the frequency and duration, what I was talking about is depending on the body exposure indices and the body burden. So say, for instance, let's take glyphosate, for instance. Glyphosate's body burden, or your LD50 for glyphosate, is 35 milligrams per kilogram per body weight per day. Okay, so if you're going to spray and you're going to spray, let's say, for instance, and you're going to exceed that 35, but you won't be able to exceed that 35 if you're spraying, let's say, for instance, 20 hectares a day at the dosage on the label, for instance. So if you're spraying 8 hours per day for 5 days a week, okay, this is how you work out your frequency and duration. If you're spraying what's on the label, so the label says you can spray 3.5 kilograms per hectare per day. You won't exceed the body burden, which is 35 grams per kilogram per body weight per day. Okay, if you spray according to the label, you won't exceed the dosage. Okay, so you won't build up. Glyphosate is an acute, which means it will be expelled out of the urine in 48 hours. It'll come out of your urine. If you are going to spray exceeding what's on the label, okay, then you are going to then start building up that active ingredient, glyphosate, and depending also if you're spraying it with a polyethoxylate teleamine, then you're going to build it up faster in your tissue, actually in your gut, really. Then you're going to exceed it. That's the frequency and duration I'm talking about. Then so your frequency and duration means you can only spray 8 hours for 5 days a week at the dosage on the label. Then you won't exceed the body exposure indices or the body burden. If you're going to exceed that, then you might have to do biomonitoring. If you're not going to spray more than that, then you won't have to do biomonitoring because you won't get to that body threshold level. Does that explain your question?
Yes, thanks.
Okay.
So in the interest of time, we have moved on to a poll question. If you would like to answer it, the link is in the chat. We will shortly be moving on to the next poll question then as well. Debbie, there are quite a lot of comments, so just indicate if you need some help with sorting through them.
Yes, please, because I think I've gotten a bit lost here. So I've got that one. Okay, I see that most of you are getting PPE, so good. That's good. It is the least. So I did say it quite a few times. So I'm glad you were listening. Okay, I can't see the next question. Oh, here we go. The industry should pay for take-back schemes for empty containers. How can system for empty containers work in? It's very interesting, Frederick, again. The industry should pay for take-back schemes for empty containers. How can EPR system for empty containers work in low to middle income countries? That is an interesting one because there's various ways you can do this. You can basically sort of get government to run a container management scheme where they put on a tariff onto the industry, where the industry has to take back the empty containers. Or you could build it into some sort of system where, like in South Africa, we have a transversal contract system where government has a national tender for other government departments. So what we're doing for the next round is we're actually going to say supply, delivery, offload, and take back of the empty containers. So if any pesticide company wants to supply pesticides to government departments, because remember, government also supplies to rural farmers, etc., they will have to come and fetch those empty containers. So you can either legislate it that the industry has to take back their empty containers, or you can make it a voluntary scheme where the pesticide companies, as part of their stewardship programs or their social responsibility, can take back those empty containers on their own will. The other issue is what happens to the empty containers that of the pesticide companies not part of CropLife, for instance. So if they're not part of like a company or some, sort of like a CropLife institution, what happens to those empty containers? So that's an interesting question. But I think in a low to middle income country, it would probably work better if it was legislated.
So Debbie, I am trying to field the questions for you. I'm also sliding through them, but there is a question from Tom Murray from South Africa. When using the hierarchy of control, should you factor in that PPE is of limited availability or likely to be removed?
What my suggestion would be is in South Africa or in any African country or in any country where it's hot, PPE is generally not used. So I would mitigate PPE as a risk. So I would not actually, I would mitigate it. I would mitigate PPE as a risk. So I wouldn't even look at PPE as a suggestion or as an option. If you understand what I'm saying, because when it's hot, they take it off. So I would rather go straight for elimination and substitution and other options. Elimination, substitution, engineering protocols, administrative protocols, behavioral, everything but PPE. Because PPE is limited, especially the PPE when you're looking at issues around, if you're looking at hazard criterions 3, 4, 5, and 6, so the carcinogenic, the tetrotoxic, the reproductive, when you're looking at the PPE that you really need to protect, sometimes you don't, like for instance, you need Tyvek suits for hazard criterions 5 and 6. And where do you get Tyvek suits in South Africa, for instance? For the inhalation risk pesticides, you need either a half face or a full face respirator, depending on the level of risk. And those are very limited in South Africa. So I would almost look at, if you know that the risk is very high, rather eliminate and substitute. That would be my answer. And I know that's quite hectic to say, but you know, you're playing with people's lives here, and I would rather than just not take that risk. Okay, and there's a question on poisoning cases reported. Are they all accidental, or are there also some intentional ones? This is not really in my presentation, poisoning cases, but what I can say about poisoning cases in South Africa, the intentional ones are not reported. I can tell you that. If it's an intentional, it's generally a suicide. But intentional homicide, those ones are not reported. But the suicide ones are actually reported, and the accidental ones are also reported. So there are a differentiation when poisoning cases are reported between accidental and intentional as accidental or suicide. You'll get that if you are one of the students, you'll get to that later on in the year. Okay, Zonke says in efforts to avoid plants developing resistance to pesticides, also noting it's not the quantity of the pesticide, but its effectiveness on those plants. Yeah, yes, but the whole idea about avoiding resistance is that it's not the quantity, it's the mode of action. And that plant is developing a resistance to the mode of action of the pesticide. So that mode of action is the same for all the pesticides in the same hierarchy group. So that plant cannot tell the difference between brush off and Kilomax, for instance, because the mode of action is the same. So it's not that, it's just this, it's the same use of the mode of actions all the time, which is what's creating the resistance. So by me using a lot of Kilomax and then thinking, okay, I've used enough Kilomax now, I must now use brush off, is not making that's not the point. The point is it's the same hierarchy or hierarchy group, or that's causing the resistance. Amisha, I agree with you. Hierarchy of control is a very effective tool. Looking at the Menti group, how would you start the hierarchy of control process? Yes, very well, everybody. You have got it first, second, third, fourth, fifth. Yes, nicely done. Elimination first, substitution in engineering, administration, PPE. Nice one. Sorry, my scroll buttons just stopped working here for a while. I'm just looking for the questions.
So Debbie, I've asked you a question. You know, you've presented to us a very detailed approach in terms of using and applying the hierarchy of control within policies in government programs. And I'm wondering if you faced any challenges getting that approach into different policies and what those challenges might have been.
Yes, definitely, because it was a mind shift from confront. I'm just using an example of a pesticide, because it's just changing the mind shift from I'm using this pesticide, I've always used this pesticide, what's wrong with this pesticide, to don't look at the pesticide, look at what the pesticide is and what the risks are of this pesticide. So when I started talking hierarchy of control and I started talking hazard criterion, yes, this is confront, but look at the hazard criterion of this pesticide. Look at all the things it does wrong. Look at all the risks this pesticide poses. Yes, there was a lot of resistance in the beginning. They all thought I was nuts, and they all thought I was just trying to, overturn the apple cart. But in the end, it was a shock in the beginning, and then now everybody now wants to know more. So I'm overloaded with questions of what is the hazard criterion of this one? What is the hazard criterion of that one? And that's why I ended up putting together that PDF, herbicides and pesticides, where I basically put every single pesticide, the hazard criterion, so that every project manager, before they put together their plan to cut anything down, they can sort of do a desktop risk assessment and say, okay, this one's the best. So without me having to tell them which one's the best, they can look for themselves and choose themselves. And now what they do is they do it themselves, and then they go back to my spreadsheet and they say, okay, yeah, no, what they chose is the same one I recommended. So yes, there was a lot of resistance in the beginning, but now they're now starting to tell me that it's a good thing. So it actually came more from the bottom up. There was more sort of acceptance from project managers first, and then it sort of built from the bottom up. So it was very interesting to see that the project managers were starting to, rather than come back up the ranks to management to say, you should listen, that this is actually much better than the last pesticide policies. I was actually very taken aback to see how it actually worked. If that answers your question.
Thanks, Debbie. Yeah, that's a very nice example of explaining how it got acceptance from the bottom up. And I think that's good for participants to note that. Thank you. Are there any last points you want to make on question 1 before we move to question 2?
Not from my side. There's a lot of, oh, sorry, Gavin just corrected me here. Thank you, Gavin. 5.6 grams per kilogram is the LD50. Thank you, Gavin.
So Tom raised the issue about shouldn't the industry organizations like FCASA in South Africa use the hierarchy of control in their training programs?
Yes, they should. And FCASA, I have been talking to Hester from FCASA, and I've given her all this information as a start to say to her, don't you think you guys should start, instead of doing your standard sort of work, because they give sort of weed control courses, etc. I said, don't you think you should maybe do one on how to choose a pesticide properly? And they're actually starting to look at doing weed control courses and including a module on hierarchy of control and GHS and how to choose a pesticide properly. So I'm actually very impressed. I'll be even more impressed when I actually see it in one of their courses. But I think we might be on the right track. Baby steps. Okay, so question 2. How do you use the GHS to choose the correct pesticide for working in hot climates near rivers? So this one is a little bit not tricky because I've already given you the answers. But if you're looking at working on any species, how would you look at the pesticide? How would you use the GHS for any pesticide? How would you use that to choose the correct pesticide for working in all hot climates near rivers? So in other words, what would you exclude and what would you include? So what are the key aspects you would look for using GHS for pesticides in hot climates near rivers? Now I'm going to scroll right to the bottom to see the answers. Because remember, GHS has 8 hazard criterions. Hazard criterion 1 are the international obligations. Hazard criterion 2 is acute. Hazard criterions 3, 4, 5, and 6 are chronic. What are the other 2? Okay, Young Chikana from Malawi says the GHS classification is a useful tool which is designed to assist farmers to know pesticides which are highly volatile and are easily dissipated in environmental compartments under very hot conditions. Such pesticides are not good candidates for foliar spraying and must be avoided, and they are easily evaporate from leaf surfaces, which reduces effectiveness of pesticide application. In addition, evaporation will facilitate their deposition in non-targeted areas like rivers. Okay, let's get the discussion going here a little bit. Hazard criterion 7, I've said, is the hazard criterion 7 is all pesticides that have hazard criterion 7. You cannot use near waters because hazard criterion 7 is acutely toxic to aquatic environments. So any pesticide that's got HC7 on its label or on its GHS, you can't use near a river. So the first thing you look for if you're going to be spraying near a river is whether it's got a HC7. So then you take that and you say, okay, no, not that one. Okay, so you take that one and you remove it completely. Then you look at, if you're spraying in hot climates, you look at all the pesticides that are volatile. So all the ethyl esters, so all the ester pesticides are volatile above temperatures of 25 degrees Celsius. Now, unfortunately, none of the pesticide companies have that on their label. Okay, so then you take all those that are volatile, and those ones you can't spray in hot climates. Okay, so also if you're in a hot climate, the other thing you won't do is you won't do a foliar application. Because obviously if it's a ethyl ester or an ester and it's volatile, you won't do a foliar application because the risk for it to become volatile is even higher. Okay, so when you're looking at your pesticide list, You're looking at all the ester pesticides, and those ones you will then take out completely. Any questions on that? Yes, Jane, you're correct. Toxic to aquatic animals, yes, and pesticides that are volatiles can cause inhalation risk being higher, yes. Yes, which pesticide would not be suitable for foliar spraying? Volatilizing pesticides, yes. Anything that has got a volatility, anything that is any fumigant, anything that has a high inhalation risk. But also because there's a two-way risk here. It's not just a risk to to human health if it's a volatile pesticide, it's also risk to the environment. Because remember, if it's a volatile pesticide, it goes up into the environment and then it moves in, and as soon as the volatility or the temperature drops, wherever that pesticide is hanging in the environment, it falls. So you don't know where that pesticide is actually going to fall out in the environment. We had a case where there was Garlon, butoxyethyl ester, sprayed triclopyr, butoxyethyl ester, sprayed in the Northern Cape at temperatures of 30 degrees. It was a foliar application. That pesticide became volatile, traveled 28 kilometers. And when the temperature dropped to below, I think it was below 20 degrees, it fell onto a grape vineyard and wiped out an entire vineyard, which we had to then pay for as a department. So the risk to spray esters on any temperature above 25 degrees Celsius is a huge risk. And also we had some reports of people with breathing issues that had to go to the clinic. Okay, so that is the huge one. Okay, and then Javier says no pesticide should be applied on or near rivers as they only affect vegetation and animals, but also affect a large group of bacteria. They affect all types of living beings. They also pollute the water and affect socio-environmental health wherever they are applied. That is correct. Unless it is a pesticide that that is specifically designed to be sprayed on water. It is not designed to be sprayed on water. So if it's not a specifically designed pesticide to be used on water, it should not be used on water. Okay, I see everybody's saying, yeah, volatile pesticides, less toxicity, easily absorbed, mixed with some spreading materials like murins, etc. Volatile, toxic to mammals, volatile. Yes, you're correct. And with the volatile pesticides. Okay, but people are not really commenting too much on toxic to aquatic animals. Pesticides are volatile, can cause inhalation risk being higher. And then William says criteria for classifying chemicals has been developed for the following health hazard classes: acute tox, carcinogenity, reproductive, specific organ. Yes, okay, so he's listed all of those. Okay, all right, so question 2 wasn't so popular. Okay, but basically what I was looking for here is near rivers would be the risk to the aquatic organisms, and the HC7, and then the volatile pesticides. So That one was right. Okay, so there's another poll up, please, if you can just answer that one. Okay, and Zonke is asking, how is the government raising awareness in regards to buffer zones around communities with commercial farming? Unfortunately, South Africa does not have a policy on our current Act 36 with regards to buffer zones around commercial farming areas or any herbicide or pesticide application areas. But I do know that there are some agriculture extension officers that are starting to discuss issues around buffer zones. And I do know there are some NGOs like Unpoison that are raising awareness in communities with regards to buffer zones, but it is not legislated at this stage. Okay, and then there's another question from Ernest. Could volatile pesticides be used with adjuvant that decrease the volatility? No, not in a foliar application, Ernest. If you can put any application of an ester, because it's an EC, is still going to be volatile. If you can use a triclopyr in a different formulation, which will make it less volatile. So, if it's in an ester formulation, it's always going to be volatile. So if you want to use a triclopyr, for instance, in a less volatile formulation, you can put it in a less volatile formulation. But if it's in a butoxyethyl ester formulation, it will always be volatile, if that answers your question. Like a triclopyr sodium salt, for instance, is triclopyr in a less volatile formulation. And then we've got Lloyd, by avoiding pesticides which exhibit persistence in soil or water and soil absorption potential on biomagnification and bioaccumulation, acute toxicity. Yes. So yes. So if you don't use those pesticides, then that's right. Yes. So basically, don't use triclopyr in hot climates, and don't use pesticides that have an LC7. Correct, Lloyd. Question. So that's Gloria. Gloria says, look on the volatility of the substance toxic to aquatic animals. Yes, Gloria, that's correct. Okay, so now we've got the EDCs. So how would you eliminate pesticides that are endocrine disrupting? Substitution where possible. Okay, so there's a list of EDCs. Yes, look at alternatives such as biocontrols if available, substitute with lesser toxics. Yes, I would appeal the government. Okay, and in this substance, all you do is you look at your list. What I was asking with this question was in relation to your hierarchy of controls, in when you are doing your hierarchy of controls and your list of pesticides you have in your country. So all you do is you look at your list of pesticides, you look at the hazard criterions of your pesticides, you look at the ones that are hazard criterions 5, which is EDCs, and you just remove them. So you just eliminate HC5s in your list of pesticides that you have, and that's how you eliminate them in your list of pesticides. Because remember, you don't have to do the entire world's list. You are looking on how do you eliminate pesticides that are endocrine disrupting chemicals, just the ones in your country when you are doing your list of pesticides for your pesticide policy. Okay, for blessings, for countries that use HCO classification, how could these EDCs be identified? There's a you can use the PAN UK's list of HHPs because all of the EDCs are identified in PAN UK's list of HHPs. So if you're still using the WHO classification, you look up your pesticide in that list and you just scroll over and see whether it's identified as an EDC. And I'm sure that, I don't know if I can, and I'm sure that you would be able to get that list from UCT. I don't know if I can quickly download it and put it in the chat box. Sorry, I can't, I'm on. Thanks, Prof.
Sorry, Debbie, I posted an article, but I will get the list and post it.
Okay, thanks, Prof. Yes, because the PAN UK list of HHPs is also the list I actually used to double check against whether I got my stuff right. So that is a very valuable tool as well to use, is the PAN HHP, the updated PAN HHP UK HHP list, which was updated in, I think it was March 2021, if I'm not mistaken. Okay, so now question 3, how would you choose pesticides safe for female pesticide operators in your country or the country you work in? So now we have a team of pesticide operators that are female, and now you're wanting to make sure that the pesticides that the female team of operators can use. So now, how would you, using the hierarchy of control and the GHS, how would you ensure that whichever pesticide these female pesticide operators use are safe for them to use? Where would you look? Yes, Amisha, that's right. You look at the hazard class. So you basically look again at your list of HHPs. You look at your pesticide list, you look at the HC criterions, and you look at hazard criterion reproductive tox 6, hazard criterion 6, which is the reproductive developmental toxicities, and any pesticide that has a HC6, female pesticide operators cannot use. So you basically look there, and all of those, if you have female pesticide operators, they can't use those. So if you have a whole bunch of women, or even if you have just 1 or 2 women in your team, those pesticides you cannot use if you have female operators in your team. I can't pronounce your name, Mamimi Honest. Sorry, apologies for crashing your name like that. Prescribe the use of pesticides that meet the 4th criterion of categories 1A and 1B of the GHS. Yes, you can do that as well. It's just easier if you just look at the HC6 of the pesticides to just look there. But you can also look at the 4th criterion of categories 1A and 1B of the GHS. But that's just a little bit more difficult to find which pesticides meet that criterion, because that's quite a big document. But yes, you can look at there. If there are no option, then we have to choose a non-EDC, non-POPs, non-HHP if possible and available. Ahmad, I don't understand what you mean there with regards to, because we're just looking for pesticides that can be used by females. So we're looking for ones that are not HC6. Yes, you eliminate and substitute all reproductive tox pesticides. That's correct, Suresh. Jane, that's correct. Pesticides that are less toxic to reproductive system. Okay, Susan says there's no safe synthetic pesticide, neither for women nor for men. Pesticides that are so hazardous that they require PPE should be banned immediately from the market globally. Women are especially vulnerable when being pregnant or during breastfeeding times, and through them, their unborn child and or little children, while, for example, reprotoxic or hormone disruptive effects are not limited to women. The specific, vulnerability of women is recognized. However, gender disaggregated data on health outcomes after exposure to pesticides is poorly available. Instead of looking for pesticides safe for female operators, we suggest to look for systematic change away from synthetic pesticide use and towards agroecology. We can do that, but I think the question was just slightly misunderstood there. What if we discourage female from handling pesticides because of their complexity? William, yes, we can, but unfortunately, in certain expanded public works programs, like in South Africa, we are required to employ 60% women. So unfortunately, for us in South Africa, in expanded public works programs, like governmental programs like ourselves, we are required to employ women. So we have to employ them. So we have to now basically eliminate HC6 pesticides. But in other countries where you can not employ women, you can do that. Oh, and then a prof is asking, how would you not employ women? Because also in most African countries, the women are the breadwinners. Excuse me. So how would you move away from that? And then Sisanda is asking, are there any initiatives that currently exist to give awareness and mostly to work on proper implementation of the safety measures of these harmful pesticides? Excuse me. And potentially eradicate their future impacts? Excuse me, I just had to cough. Awareness programs, yes, mostly to government organizations, but not on a large scale. So unfortunately, there needs to be a beefing up of most of our awareness programs. Okay, and then okay, Andrea, and then if we go to the poll about choosing the correct PPE for pesticide category, according to the labels, depends on the area of application. Look at the labels, correct PPE for operator category, gloves, hats. Okay, there's a lot of different answers here. According to labels, correct PPE for operator category would be unrealistic and practically wrong, given that all synthetic pesticides are inherently hazardous. Therefore, even so-called correct or appropriate PPE may not give desired protection. I agree, but if you only are able to do this, the whole idea with this this poll was correct PPE. How do you choose the correct PPE for the pesticide operator category? This debate was basically to spark a debate about you need to know whether the pesticide operator is he doing a cut stump, is he doing an aerial application, is he doing a foliar application, is he doing it with a forward knapsack, a back mounted knapsack, is he Is it in an enclosed spray, like in a closed tractor spray boom? How is he doing it? What kind of PPE does he need? Because obviously the guy that's got a back-mounted knapsack and a guy that's got a lance knapsack is going to need different PPE. If he's doing a cut stump application, or if he's doing a foliar application, if his exposure risk is dermal, if his exposure risk is inhalation, if the main exposure is his eyes, is the main exposure in his face, his hands, surely then your correct PPE would depend on where that exposure is. So based on mode of pesticide application. So the worst answer would be according to the label. And the reason for that is on the label, it's a standard question. It's a standard thing about goggles, gloves, overall boots. And that's that whole thing about one size fits all, which is the worst that you can do is give a one size fits all, because it's not a one size fits all. So your PPE, and this is where it becomes expensive, especially in local conditions in African countries, is that if you have to buy PPE for a dermal risk pesticide, for a cut stump application, and then a dermal risk pesticide for a foliar application, and then PPE for a inhalation risk pesticide for a cut stump, inhalation risk for a foliar application, you're looking at 4 different types of PPE. And then you've still got the PPE for the let's call him a general worker, which is not applying pesticide, but he's also in the team. He doesn't get the same PPE. So you've got so many sets of PPE that you need to buy, and you can't buy all this PPE. So what do you do? So surely, if you're looking at all of this PPE for categories 3, 4, 5, and 6, which are all this sort of, let's call it specific PPE, why don't you then just eliminate those pesticides so that you don't need to buy all this specific PPE for all of these hazard criterion where you've got risk? Wouldn't that be a better option? William's saying, I suggest PPE suitable for wearing by women because in most cases, women are not comfortable wearing PPE, even if it's available, especially overalls. Yes, and in most African countries, there is no PPE for women because women don't want to wear pants. And how do you suitably protect a woman in a dress? So that's another case for should women be spraying, because how do we comfortably mitigate the risk on PPE? So that is our problem that we have. And then there's another question. Tuli's asking, in your department, how do you ensure that the PPE is effective against a pesticide, especially the mask for those pesticides with inhalation risk, also considering the fact that air monitoring is really undertaken? Tuli, in our department, what we've done is we have, as I've said, that we've got different sets of PPE for different applicators and for different herbicides that we use. And we've got mostly half-face respirators for the hazard criterion 2s have half-face respirators. The hazard criterions 3 to 6 have full-face respirators, but the hazard criterions 3 to 6 we rarely use. We mostly use the hazard criterion 2 pesticides, so we mostly have half-face respirators. At the moment, we have very few teams in field because there's such a let's call it, we cannot source the half-face respirators fast enough. There's a lack of suppliers of half-face respirators in South Africa. So we cannot get all our teams in field. So that is our other issue. So what we're trying to do is we're trying to move most of our teams over from pesticide operators to biopesticide operators. So we've got a lot of our teams now implementing not as our normal terrestrial teams. We're now calling them our biocontrol teams or our biopesticide teams. So they're now sort of, especially on the species that have biopesticides or biocontrol, they're now starting to spray hack attack on Hackia, stump out on the acacia species, as opposed to pesticides, because in that situation we don't need to put them in hectic PPE. They just need a FPP2 mask, an overall, gloves and boots, because it's a biocontrol agent that we've commercialized as a biopesticide. So in that sort of situation, that's what we're trying to do. Also, so we can reduce the risk to the operator, but also so we can get our teams back in field. Okay, so Andrea's Prof is answering that one. Okay, there's a bit of a discussion going on there. Okay. Okay, I think this is the last poll. What PPE would you choose to be worn for inhalation risk pesticides? I see respirators. I see respirators with replaceable cartridges. But what respirators? You get different respirators. Because remember, we're talking about inhalation risk. So what happens if you're talking inhalation risk? This is a little bit of a trick question here, because if we're saying inhalation risk pesticides, we're talking not about acute risk here, we're talking about chronic risk. So in other words, we're talking about a risk where there might be either some sort of so this is the risk so this has a criterion where you see the little man, the hazard pictogram will be the little man with his lungs, will be on the label of the pesticide. So this would be hazard criterion 3, which would be HC3, which is carcinogenic. Inhalation risk pesticides are generally carcinogenic pesticides. Prof is asking, when DFF issues respirators, how often are the filters replaced and how many respirators are we looking at approximately? Prof, it depends on, again, the frequency and duration of the spraying, because the actual respirator depends on how long the contract is. So the actual respirator will be replaced every 3 months. So they get one respirator every 3 months. The cartridges or the filters will be replaced every 100 hours, depending on the frequency and duration of the spray. And also depending on the pesticide being sprayed, if that answers your question. So again, it also then depends on what they're spraying and how often they're spraying that pesticide. Sometimes the respirators are replaced more, not the respirators, the cartridges are replaced more often, depending on the pesticide. I do know that Confront, for instance, those cartridges are replaced more often than the plenum cartridges, for instance. And then Jane is asking how correct and effective the PPE provided by the companies could be. This one is very interesting because I don't think companies at the moment are. It depends. That's why we have, as I said, we've got that that quality assurance department, and they go out and look at whether our service providers comply. And at the moment, I don't think our service provider compliance is very good at the moment. But I think it will take time, and we have given them a, let's call it like a phase-in period to get compliant, because obviously the new PPE and replacement is going to be, you know, quite a expensive job. But on the new contracts, which haven't been awarded yet, this is a requirement. So from the day one on the new contracts, as soon as they get awarded, they will have to comply to all of this in the new contract. So from day one in the new contracts, they will have to be compliant. And then I'm just looking at all the answers in the question in the chat in the poll here. It would be if you look in the pesticides and herbicides and pesticides document I sent through, it gives you exactly the codes on what the respirator codes are, and the cartridges for the respirator codes. And I think someone has read it, because it's the EN 11620001. Sorry, it just disappeared off my screen. But yes, there is codes exactly for the half face respirators and the full face respirators. So there's codes for them. You have to buy the right. There you go. 166201, 140, 149, 143. So the respirators need to meet those codes. The replaceable cartridges have codes to go into the proper respirator. So you cannot just go buy cartridges and stick them in the thing. They are specific. So we've given you exactly what half face respirator must go with which pesticide, what full face respirator must go with which pesticide. So you have to look at what is it a HC2? This is the respirator used. Is it a HC3, 4, 5, or 6? And this is the respirator you need to use. Okay. And then there's just a couple of questions here quickly. Will you? Okay, no, that's okay. We've got 5 minutes left, but I've just got a couple here quickly. I need a follow up to the Prof's question. What cost is DFE incurring per year on PPE alone? In some countries, there is low budgeting allocations of government departments. The PPE that we're probably spending in the region of about, and you're going to get a little bit of a shock here, and I stand under correction because I don't have the full figures with me, probably in the region of about R1 million, if not a little bit less or a little bit more on PPE a year. But now you remember we're talking in a budget of about in total about R1 billion for all our projects. 1 billion rand and about 1 million rand on PPE. So if you put it into perspective, it's really not a lot of money.
So we've got 2 minutes left. I wondered, Debbie, if you want to just make a final statement before I close what has been an absolutely vibrant and important discussion.
Okay, so guys, just the last point I want to make is, please, can you just, when you're doing putting together your pesticide policies, please do keep into account a hierarchy of control, and please do your substitutions and your eliminations. Keep into account that, especially in African countries, first of all, PPE is not going to protect your workers, and PPE is probably scarce and expensive when it comes to the PPE that you're going to need to protect your workers. Please look at the hazard criterion according to the GHS when you're looking at which pesticides you're going to use for what, whether it's invasive alien plant control, whether it's agriculture, whatever. Please compare the hazard criterions of the pesticides that is registered for whichever species, crop, whatever that you're looking at. Because the hierarchy of control and basically the method that I've shared with you today, you can implement on forestry, agriculture, invasive species, anything. You can take this method and implement it for a pesticide policy on anything, whether it's a crop or forestry or whatever. But the most important is your hierarchy of control, your GHS, and your PPE. If you cannot mitigate the risk and you cannot afford the PPE, remove that pesticide. Thank you.
So firstly, Debbie, thank you so much. You have packed in an enormous amount of information in a short period of time and years of work in a short period of time. So thank you for that. I encourage people to make sure you look at the documents that Debbie shared. Debbie, I assume you don't mind if people contact you if they have questions, if they want to implement some of the things that you've suggested.
No problem, because the more people implement this and save people and save the environment, the better my heart will be.
Thank you. Thanks for that. Just to say, there is an evaluation poll, 2 questions that has been launched, and thanks to the 32 people who've already responded to it. We appreciate that. So first, again, a very big thanks to Debbie for her time, for taking us through. Thank you to all of you participants who've been very active and engaged and included all your different perspectives and thoughts. Thank you to Naomi and Tatum in the background who were doing the technical work. Please do make sure that you've joined the pesticide discussion forum. The links have been posted for you in the chat. We also have a newsletter that comes out with additional information, as well as upcoming training and webinars and opportunities. So make sure you join the newsletter as well as the pesticide discussion forum. We will be producing a digest from today's discussion, which will be emailed to you and WhatsApp to you. We do have a WhatsApp group that you can join. And we encourage you to share that with your colleagues or use it for teaching or training. And then lastly, just to draw your attention that our next discussion will be on the 17th of March, where the African CAMOBS program that's currently underway with UNEP will be presented, and specifically how to use some of their economic and vulnerability calculators for decision making. So I hope you will put that in your calendar and join us for that. So thank you very much to all of you. Stay safe, and until next time, bye for now.
Bye, everybody. Have a good day.
Bye, everyone.
Bye, Prof. Andrea. Thank you, Debbie.